Well, I'm so excited today to introduce Dr. Mark Filidei. He's our functional medicine doctor here at the Amen Clinic, so welcome.
Thank you. My pleasure.
So people still get a little confused when I talk about functional medicine. So the first thing I want to do is talk about, or have you talk about, what functional medicine is, explain it clearly to our community, but then I want to tie in how it relates to psychiatry, because that's what really throws people off. A lot of people still think that all we do is medicate people heavily, and I want you to explain to them how functional medicine relates to psychiatry, why it's so important in our practice, and how you do that with our patients. So can you do that?
Yeah, how much time do we have? So functional medicine, just to start with, is really the way all medicine should be practiced. So it's the layer down, it's the bottom layer. Why are you this way? So for instance, if you're diagnosed with, let's say, rheumatoid arthritis, okay, you go to your doctor, you have RA. Here's where you start. And then you get treated with drugs, medications,
so that'd be Western
from that. That's Western medicine approach. Now, the question that we ask with functional medicine is the layer below that. Why do you have RA?
So we want to know the root cause.
The root cause. And so it's really, basically, really in-depth biology and biochemistry applied to all health conditions. Now, when you apply that to mental health,
right.
So I was doing functional medicine for years for everything except mental health, for heart disease and cancer and diabetes, and helping a whole lot of folks. But when you apply it to the brain and mental health, dramatic results. And really, I think this is, what Daniel's been promoting all along is you got to look at your numbers. You have to look at the cause of all this. Don't just get a drug.
And when you say your numbers, so we take pretty extensive blood tests, right. And not just blood tests, sort of other tests as well. You do a lot of testing. We start with a blood test, and then from there, if it's not really explained, then you go deeper. You start to dig deeper. And I know I was a trauma nurse, and so we would say that if someone just starts medicating without really looking at why, we call that putting a Band-Aid over a bullet hole.
Exactly.
So
right.
We don't want to do that.
Right. So it's that's symptom control, right? So you're treating a symptom, you're not addressing the root cause of the problem at all. Now, you can use medications while you're trying to find what's going on deeper down. But eventually, people don't have a Prozac deficiency, right? That doesn't exist.
That's hilarious.
Now, could they have a progesterone deficiency causing their anxiety? Absolutely.
Oh, I would be on the evening news. I promise you, I would be on the evening news. It's why I don't harm like small animals and children. It's why I'm not divorced. I promise you, is progesterone.
Progesterone
that is my secret.
Things that calm you down. I call it natural Valium.
Right.
So again, the whole point is, if you go to another mental health facility, psychiatrist, they're not going to be thinking that way. They're going to be thinking, what drug is going to fix that?
Right.
Not what hormone could do it. Why do you actually have that problem? So, and that's just one example. I mean, there's many more with gut function and metals and
let's talk about that. So the gut, probiotics. If your gut's not right, your brain's not right.
Absolutely.
Okay, what about Lyme disease? We've had patients that come to us that have been diagnosed with schizophrenia that are tanked on several medications, and we discover that they have Lyme disease. They are actually institutionalized, right? They're in an inpatient facility.
Oh, yeah.
And then we end up treating them, you treat them with what? Antibiotics or?
Yeah, find the infectious organism, find the cause of this inflammation in the brain. So there's a condition called PANDAS, which it's a pediatric condition, typically happens in kids after a strep infection or several strep infections, and all of a sudden they have OCD or bipolar disorder or ADD, and it wasn't there before. Now they'll get treated for those conditions if they go to psychiatrists.
So multiple medications.
Medications, hospitalization, and it's a strep infection. And you need to treat that and not OCD.
So how would you know if you don't look?
Exactly. And there are tests that help us look for that. And that's, again, just one example of many different conditions. So, I'm always looking for metals. Mercury can cause you to have anxiety and insomnia.
We had Tony Robbins here, and he was not feeling right. And he was starting to shut down on stage and forget things. And he discovered that his mercury was off the charts.
Right.
So he came and got scanned, and that was really kind of cool.
Some of our listeners may have heard of the Mad Hatter, right? The Mad Hatter is a real thing. People that used to make hats in Old England would take animal fur and use mercury salts to turn that into felt to make the hats.
Oh, interesting.
And they went mad, literally. They went crazy, and it was a tremulous, anxiety, shaky kind of madness. That's mercury. That's where Mad Hatter comes from. mad as a hatter. So you can
my
still
gosh.
get that by just eating too much tuna, right? Which is loaded with mercury. So I ask all my patients, do you eat a lot of tuna, sushi, or swordfish? And a lot of them say, oh, I have that every day or every week. And you're going to be accumulating mercury, which can affect your brain and your hormones. And so again, things like that you're just not going to get if you go to other places.
So I love this. So now you can see why we incorporate functional medicine into our practice. It's a question I get a lot. People send me, I'm not a physician, okay, but I get these crazy questions on Facebook, and it's good. I'm glad please keep sending them. Email them to me, keep sending them. I know they send them to me because it's sort of their way to get to Daniel or to get to our doctors.
Sure.
I can't actually give you medical advice. What I can do is connect you. So I will connect you. I will get those answers for you through our physicians. I'll get the answer from Daniel or from our other doctors and from Dr. Filidei. So if people want to talk directly to you, how can they do that?
So they usually can just, if they're not going to come in for our full evaluation, they could just talk to me over the phone. I can do Skype or phone, even if you've never come in. So we usually do an hour appointment, and I can actually send test kits out to folks and get them started on the road, after I get their whole history, figure out what might be causing their problem, and we can get things going that way. And we do a lot remotely without even coming in.
So if people are housebound, or they're not local, you can still talk to people.
Absolutely, yeah.
Okay, well, that's really good to know.
Right.
And I know some people will say, but you're cash only, and I know that some of the services are cash only, but some of them we actually will help you fill the bills out, and you can send them to insurance.
Yeah, like the
so
lab.
some things are covered.
The lab should be covered. If you have insurance that covers your blood tests, they should be covered. There's some tests that we do that are just specialty that don't get covered, but those can be reasonably priced too. And we're talking about your health and your brain, and
if you're not feeling well and you're not
better,
working, right? So you have to weigh that out. So, but we're trying to make it as accessible as possible.
Right.
So those are some options. So thank you for explaining functional psychiatry. That was
Sure.
great.
Yeah.
Appreciate it.
Very helpful and amazing topic. I've again started doing this in the last decade, spending the previous time treating regular health issues. But boy, if there's any field in medicine that needs this, it's mental health.
Absolutely.
Big time.
Because we still practice backwards. I mean,
Yeah, absolutely.
It hasn't
There's
changed.
no science to it. It's just throw stuff at people and see what sticks, and then try something else. It's just not good.
So we're going to post a link. If you want someone to contact you from our call center, we can help you with that. If you want to contact our call center, we're going to make it easy for you. If you are suffering or you know someone who is suffering, please reach out. Thank you.